What a time to come on, right? As I was coughing into my elbow. Hello, and thank you for tuning in to our Facebook Live Q&A about COVID-19. I'm joined again by UI Hospitals and Clinics hospital epidemiologist, Dr. Jorge Salinas, who will give us an update on the state of the pandemic and answer questions about precautions, the holidays, and more. Please submit any questions or concerns you have, and we'll answer as many as we can throughout our discussion. Thank you for joining us again tonight, Dr. Salinas.
Glad to be here.
So can you give us an update on what the state of the pandemic is in Iowa?
So Iowa, as many other states in the Midwest, is experiencing a large outbreak. The epidemic is worsening. The number of new cases continues growing every day. Roughly, Iowa is diagnosing in between 3,000 to 4,000 new cases every day. And that's very problematic. Obviously, that translates into hundreds of people being hospitalized and unfortunately deaths as well. So I think that Iowa is at the moment at its worst in terms of the COVID-19 epidemic. We've been dealing with this for a number of months, but this is probably the worst part that we've dealt with.
Great. And you kind of already touched on it a little bit, but how does a surge in COVID-19 cases or just a bigger increase like we're seeing right now affect hospitals like ours?
Absolutely. If the number of patients that need attention for COVID grows, they can start occupying a large proportion of the beds available, and also the number of doctors and nurses that we have available to take care of those patients. So they may end up competing for that capacity of healthcare for people that have other medical conditions or people that require surgeries. So yes, it's problematic at many levels. When the incidence of COVID goes up in the community, again, just directly, there are more people that are sick, that cannot go to work, cannot go to school. They may need to go to the hospital, but at the same time, they can. This amount of transmission can put too much pressure into the hospitals and can impact the outcomes, the health outcomes of those that have COVID and of those that don't have COVID.
Thanks for that update. With this increase in cases we're seeing in Iowa, is it still safe to come to our hospital for appointments?
Yes, especially because you come to get to an appointment because you need to. Now, hospitals are trying to be very creative, and they have video visits available, etc. But yes, hospitals are some of the safest places, especially in the outpatient area. Hospitals have an increased amount of air exchanges. They have requirements for everyone to wear a mask. They try to maintain distance. People use hand hygiene frequently. So if you have an appointment, please go to your appointment. If your appointment is completely elective, you may want to delay it some. That may still be okay. But if you have diabetes, heart disease, lung disease, that you need to have it assessed to modify your medications, for example, please go ahead and come to our clinics.
Yeah, absolutely. It's so important not to neglect your physical or mental health right now. With some of the most positive news I've heard all year is that Pfizer's early data shows that their COVID-19 vaccine, the one that we've been testing here at the University of Iowa, it might be more than 90% effective. And that sounds like great news. So what do you think about this?
It is fantastic news. This is an interim analysis. It's not the final analysis. And when the trial is complete, the data will be submitted to the FDA for an assessment of its efficacy and safety. And if the efficacy is as good as it appears to be in the interim analysis, it will surely get a rapid approval. It's expected that may happen before the end of the year. So the deployment of this vaccine may happen in December or January. It's not clear yet. First, we don't have the approval yet, but and second, but we're very hopeful that it will be approved. And but second, we don't know yet how many doses will be available. So yes, I would want to continue being optimistic. This is great news. I think that this is going to change the game altogether, and hopefully will make the pandemic or will, yeah, will help decrease the numbers tremendously in the United States and globally. However, it's a new vaccine. There are multiple steps that are needed, and not all Americans may get vaccinated by the end of the year. So it will probably take a few months, but at least we know that there is a deadline. Soon, let's say by the next summer, it's possible that all Americans will have a COVID vaccine, and then this thing will be almost over. So the end is near for the pandemic. However, the pandemic is in pretty bad shape right now here in the Midwest. So yes, there is some good news. We need to continue doing the right things so we can wait until the vaccine is available.
Yeah, and since we don't know when it will be widely available to the general public, what are the things, just as a reminder, what are the things people need to do now while we don't have access to the vaccine?
So I think at this point, the number one recommendation I have for people is to, and I'll have a number 1, 2, and 3. Yeah, but number 1 is to avoid large gatherings. You shouldn't gather with more than 10 people socially. Second, very close to the first, is you need to wear a mask. You need to wear a mask. Third, you need to maintain your distance, 6 feet of distance or so, and then continue doing frequent hand hygiene. But at this point, we have to limit our socialization. So social distancing or socialization is something that you can dial up or down depending on what the epidemiologic situation is. Right now, with this amount of transmission, the risk of you bumping into somebody that has COVID is too high, and that's why you want to limit your social interactions. Only go to gatherings that have no more than 10 people. Try to do it outdoors. That's probably recommendation number 1, and then number 2, wear a mask.
Yeah, and you're touching on some tried and true infection prevention strategies, right? Like there's been a lot of skepticism this year about masks and about other steps, but the things we're recommending are proven ways of preventing the spread of not only COVID-19, but colds and flu, correct?
Correct. These are the measures that very successful countries have used. The Centers for Disease Control and Prevention, the CDC, recommend these practices. And as of today, the state of Iowa has implemented mask mandates for some social gatherings. So yes, there is no debate that masks work. So please use them.
Thanks for that reminder. It doesn't hurt to hit it over and over again. Speaking of skepticism, there seems to be some skepticism about the COVID-19 vaccine, partially because it was developed so quickly, and that seems unusual to people maybe not in the scientific community. So why should people trust the safety and efficacy of the vaccine when it is approved?
So we have a number of scientists. We have clinical trials that are being conducted assessing the efficacy of the vaccine, and the results of the trial will be reviewed by scientists in the scientific community, but also by scientists in the federal government. So when we do these type of trials, all the data becomes available, and other scientists will be able to judge whether the conclusions of the trials are correct as to whether the vaccine is safe and efficacious. We think that it will be the case, but we won't know for sure until the trial is completed.
Great. And I have a question for you, a personal question. Will you be getting the vaccine when it's available?
200%.
I feel the exact same way. If you're just joining us, we're here with Dr. Jorge Salinas, hospital epidemiologist here at UI Hospitals and Clinics, talking about COVID-19. Please comment with your questions and we'll answer as many of them as we can. So Dr. Salinas, we've gotten several questions on social media, so let's pivot to those. Several people on Facebook have asked about pre-existing conditions. Can you explain to our audience what kinds of pre-existing health conditions put someone at higher risk for COVID-19?
There are a number of those: hypertension, diabetes, chronic heart disease, chronic lung disease, chronic liver disease, chronic renal disease. Um, uh, Obesity is also a big risk factor, and overall age. The older you are, the more likely it is that you may have a severe disease. So if you are over the age of 50 or 60 and you're overweight or obese and have diabetes, you need to be very careful. Wear a mask, avoid socializing for the next few weeks. Vaccine is around the corner. I think that we could try a little harder for a few more weeks and try to save as many lives as possible.
Are the precautions you would recommend any different for people who have like a heart condition or diabetes, anything that puts them at higher risk? Should they just do the things you already mentioned, or are there any additional things?
Absolutely. They should do the same things. They have to be very judicious about who they interact with. Hopefully, they would be interacting with people that are very mindful of these same recommendations. But this is why we try to, we all have to do the same things. We all have to follow the same steps because COVID is very tricky. And if the incidence in the community is very high, as it is now, even people that are doing all the right things can possibly get it. So there is that possibility. So, the approach has to be a societal approach, a team approach. I do it for you, you do it for me. If I don't get it, maybe I'll do great. Maybe I'm super young and athletic and nothing happens. The problem is that I can give it to somebody else when I'm at the grocery store, at work, in a family gathering, etc. So yes, they need to be extra careful, but that's not enough. We all have to be extra careful for everybody else in our community.
Yeah, it's similar to mask wearing. If I wear a mask and you don't, we're not quite fully protecting one another. But if we both wear masks and we both follow all the precautions, like being apart, it's much safer.
Absolutely.
Jeff asks, is it safe to go to the gym and exercise inside amongst other people?
Not right now. Not at the moment. I think that people should not. Again, following these principles of being in places where there are less than 10 people, everybody has to be wearing a mask. So there are some gyms that are very creative, that are open 24/7. So if you go at 2 a.m., you're the only person there, no problem. You can go. But if your gym tends to be busy, I would recommend not going there. The weather is still very nice outside. Go for a run, stretch outside in your backyard. There are other things that we can do. Right now is not the time to be around many other people that you don't live with indoors.
Yeah, and I think it's good to remind people, because saying don't go to the gym right now or don't gather with your friends right now can feel hard to hear, but this is temporary. If we take these precautions now, we will get back to a sense of normalcy sooner, right?
Absolutely, yes. Yes, the answer is yes. Right now, Iowa, as I mentioned earlier, is reaching a critical point in the number of new infections and hospitalizations. So it is a time. It's a time for all of us to take extra precautions, to be even more careful, to dial down our socialization, so we can bring those numbers down. So hospitals have enough capacity to take care of everybody that is sick. But if we are all trying to continue going about our lives without minding the entire society, we're going to overwhelm hospitals.
Yeah. One person on Facebook says she was hospitalized for COVID-19 and is wondering what type of mask would be best for her to wear as she returns to work.
Public health recommends for people to be isolated, to not go to work for 10 days if you had mild or moderate disease, or 20 days if you had severe disease. So if that time has passed and if you feel already well, you're not infectious anymore. If 10 days have gone by, or 20 days if you had a severe case, you're not infectious anymore. So you can go back to wearing the same mask that you were wearing before, be it cloth mask or medical grade one.
Great. Luann asks, what are antibody studies and post-infection studies showing us? Are antibody producing patients rendered immune? And if so, do we know how long that immunity lasts?
Yes, antibodies are very tricky to understand. It's true that whoever has recovered from COVID seems to have some immunity to it for a number of weeks or probably months. We don't know for how long. It is clear that some people have gotten reinfected after a few months. So that's why we say that even though you have recovered from COVID, you need to still follow the same recommendations of mask, distancing, hand washing, etc.
Yeah, I think you hit the nail on the head earlier when you said COVID-19 is tricky.
Yes.
There's still some things we just don't know for sure. So err on the side of caution.
Yes.
Teresa asks, if everyone started wearing masks and continued social distancing, how quickly would you anticipate the positivity rate to start showing a decrease? So this is kind of like a crystal ball question.
I would say immediately. It has to do with how many people are doing it. But if everybody in Iowa decided to, okay, let's take this seriously, let's stay at home, we're not going to go visit anyone. Everybody wore masks when they went to work and to grocery shopping, etc. Yes, the incidence would start going down immediately.
That sounds so awesome. I wish that would happen. I encourage everybody to start wearing your masks and stay home whenever possible. Bet asks about at-home COVID tests that she's heard about. Do you know if those are reliable? Have you heard much about those?
I think that as days and weeks go by, we're going to learn of more and more options. I think that if, and I'm not familiar with all tests, but many of those will probably work. If you feel sick, for example, and if you do the swab yourself, I think that it can work. So yes, the more strategies, the more options we have for testing, the better. So yes, I think that would be acceptable.
Great. Jan asks, would you cancel routine dentist appointments if they're not immediately necessary?
Not necessarily. I would still go to my dentist, and there's a reason why I go every year, right? So if you feel that your dentist's office has protocols in place to distance people, for it not to be crowded, it may be okay. Now, if you have, again, if you're at a high risk of COVID, you want to take it extra, carefully. It may be okay to delay your appointment for 1, 2, 3 months. That's also acceptable.
Great. So we're going to pivot back to some of the other questions we have, and we'll see if any more questions come in from Facebook. The holidays, the hot topic right now. The holidays are quickly approaching, and people are wondering what to do about their usual celebrations. How do you suggest that people celebrate this year?
I think that we should give people some freedom. They should be able to still celebrate with these few caveats. Limit your gathering to less than 10 people. Everybody wears a mask. If you can, maintain some distance within the house. If you can, open windows. If the weather, if we're blessed and the weather is nice, by then, try to spend some time outside. Following those recommendations, I think we can probably get together. Let's try to get together if we are going to get together, with people that are following precautions equally, carefully. So that's if you're going to get together. If you can avoid it, just then try to get together only with your own household. But if you're going to socialize with people outside of your household, limit it to 10 people, masks, frequent hand hygiene, maintain some distance.
Yeah, and we're encouraging a lot of people to consider virtual options because we live in a time, thankfully, where we have those virtual options. So, like I know for my family, I'm zooming in to my mom's house, and her and I are going to do the turkey together the night before, wearing masks, separated. She's just going to tell me what to do as we're stuffing the turkey. So we're finding ways to do it safely. And so, do you have any other recommendations for like virtual stuff people can do, or other, besides for getting together, taking precautions, are there any alternatives you would suggest?
No, I agree. I agree. If you can use Zoom, Skype, FaceTime, there are just so many options. So absolutely use all of it. Snapchat, I don't know. Use whatever you have at your disposal. But whatever you do, try not to be in groups of more than 10 people. That's the key. That, and try to not be around people that don't have a mask. If you go into a gathering and you see that nobody's wearing a mask, just leave. Don't be there.
Just run. We can include this link in the comments for people who want to see it, but you shared with us the last time we talked a gathering risk assessment tool that showed for your county what chance there would be another person at your gathering with COVID-19. And so is that still a tool you might recommend people just reference before they consider gathering?
I think that's fair. I can already tell you any gathering of more than 10 people has already an unacceptable risk. So wear masks and limit the number of people you socialize with. That's going to be probably my recommendation for the next month or so. Maybe by Christmas, things will look differently. I hope so. Christmas is my favorite holiday. So, but for now, that's what we have to do.
And Thanksgiving's my favorite holiday. So you can tell how much this bothers me that I can't get together. But, it's the best. It's the safest thing right now.
There's another one next year. How about that?
That is true. And I'm still going to get to eat good food. I'll just be at home by myself with.
Yeah, these are the small modifications we have to make to keep our family members alive, to keep them from having to go to the hospital. It's completely worthwhile.
I agree. Yeah. So mental health issues can arise throughout the winter any year because of the isolation we experience, especially in cold areas like Iowa. And this year might pose even more issues for people who are staying home and maybe not attending holiday gatherings. Do you have any advice for how people might cope, or what resources they might tap into?
Call your family. Maintaining physical distance doesn't mean that you're socially isolated. Call people. Again, now you can do video calls. Get into the habit. Now we text a lot. Just give them a ring. Surprise your mom, surprise your friends. Spend 15 minutes talking and gossiping about things. You can continue having or sharing experiences, sharing ideas with others while being safe, slightly apart.
Yeah, I agree. That's a good one. Abby from Facebook asks, if two households are taking the same precautions, like working from home, virtual schooling, curbside pickups, not gathering with others, is a bubble like this safe to be around, and are masks required?
Yes, I think that's a fair compromise. If both families are following the same precautions, you can consider those two families part of one bubble and can get together. As long as those get-togethers don't go over 10 people. Now you can stretch it to 12, and depending on what you have many children or not. But I'm not saying in your neighbor everybody's doing the same. Let's have a party with the entire neighborhood. It just wouldn't work that way. So a couple of families that are being very judicious, I think it's fair.
Great. So that's all that's about all the time we have for tonight. So I just wanted to give you a chance to share any final thoughts or concerns or advice you might have for our audience.
Yes. I would say that Iowans, we can do this. The next few weeks are going to be tough. Hospitals are going to be busier. People are going to get sick. But we can do this. Let's protect ourselves. Let's protect others. Wear a mask. Maintain your distance. Don't go to crowded places. Very important. If there are these large weddings with hundreds of people, do your best. Try not to go to those places. If you end up going, wear a mask. Be there for some time and leave early. The more time, 15 minutes, 30 minutes, 1 hour, that you spend in a crowd, the greater your risk of giving COVID to others or getting COVID yourself. Let's try not to do any of that for the next month, and perhaps we can have a more normal Christmas.
Yeah, because one thing we haven't touched on is that if you're not careful at some of these gatherings and you have to spend Christmas in the hospital, or grandma's in the hospital for Christmas because she caught COVID-19, that's something we haven't really touched on in this discussion is you could miss a lot more by enjoying this one thing because it's so rampant in our communities right now.
Absolutely. And I really like and welcome and congratulate our state leaders for implementing a regulation, a mask mandate. And that tells you that no matter what political party you support, we're all in this together. These are public health recommendations. These are recommendations for the public, for all of us to live a normal life, a happy life, a healthy life. So please, masks are not a political statement. Please wear them. Your oxygen levels will not go down, and you'll do a lot of good. Less people will get sick in Iowa, and again, most of us will be around by the time a vaccine is available. That is not too far down the road.
Yeah. Thank you so much for joining us again tonight, Dr. Salinas, and sharing all of this great information.
Absolutely. Take care.
And thank you, everyone who tuned in. If you joined us after we started, make sure to go back to the beginning to get all of the great information that Dr. Salinas provided us. And stay tuned to our social media accounts and our website, uiht.org, for all the latest information about COVID-19 as we have it. Lastly, remember to please wear a mask, wash your hands often, avoid close contact spaces whenever possible, and take good care of yourself and your family. Thank you so much.